So as a therapist, I work with a lot of people through their traumas. And trauma generally has three main stages. It has the beginning, middle, and ending stage. Beginning stage is about safety and coping skills development and your support circle and your environment. Stage 2 is processing, going through the trauma, depending on what intervention and what kind of orientation the therapist uses between you and your therapist. And then stage 3 is when you reintegrate back into your life after you've processed and have these skills. Sounds pretty simple, but there is actually one thing that I do often talk to a lot of new therapists about, even seasoned therapists, that is really forgotten and really not discussed it really wasn't discussed much when I was in school. And that is how to really set a client up for as much success as you possibly can before stage 1. So there's like this pre-stage. And there's a lot of different types of therapies that discuss this. One of them is called the neurosequential model of therapy. Great model. And what that model and a couple other models discuss is before you even go into stage 1, before you even say, hey, let's go over some coping skills, let's go over your support network, let's help you identify certain resources in the community that you need, there's really something about setting the stage for your environment. Because making sure that you have a reduced triggering environment or de-triggering your environment is largely beneficial. Let me give you an example. So I'm going to imagine myself working with someone who maybe they had an upbringing of traumatic instances with their mom who was an alcoholic, and they're 30 years old and they're now coming to work with me and they want to work through this trauma. And before we go to stage 1, the coping resources and your support network, we want to get to this kind of pre-stage, which is looking at your environment and kind of reducing the triggers within that environment. And here's why. So I'll sit down with the client and we'll go over, what's going on in their environment and what their goal is and what they best want. And then from there, we'll identify, okay, so before we go into any type of coping strategy, psychological tools, techniques, any of that stuff, what's your environment look like? What's going on? Oh, I live alone, and I drink here and there. I socially drink. I hang out with my friends, play game nights. I sometimes go out. I kind of get the lay of the land. And then from there, I say, okay, you tell me that you drink. Tell me more about that. And they're like, well, it really has nothing to do with my mom. I'm like, okay, let's just take a guess that if it were to, how is it when you drink? What does that feel like? What do you notice? And maybe they'll say, well, when I do drink, I do think about my mom, but like it's very quick and short-lived. And then as I'm drinking, I sometimes feel like a little sad, but I'm also like trying to have a good time. It's like, okay, that sounds like you're just trying to understand it or something that you just notice. And I'll say, okay, how often do you drink? They're like 1 or 2 drinks each night, 7 days a week. I'm like, okay. So, do you suppose that could be a trigger for you? Something that just bothers you? And they're like, well, maybe. I don't know. So they're kind of stuck in limbo with this. I said, okay. I said, let's not make any drastic changes to your environment. Because the point of this is to just test things out, trial and error. Because we're really trying to work in this pre-stage. So I say, go home, pick a day of the week where you reduce drinking by a drink. Or you just don't drink that day. Big deal? And they're like, no, not really. They're like, I can go 2 days. And I said, whatever you want. So they pick Monday and they see me Tuesday. So Monday's the night they don't drink. They hung out with some people, and then and they had a good time. They see me the next morning. I say, how did Monday go? They said, well, I didn't drink. I said, well, what did you notice? They're like, well, I didn't really think about my mom too much. They said, until I thought about drinking and I did see my bottles, which I have, on my countertop. And I said, okay, so what else happened? They're like, well, I thought about my mom and I still felt pretty bad. And I said, oh, so you feel pretty bad this time? They're like, yeah, like maybe I wasn't as honest as last time. I really thought about it. I said, got it. So we're talking about something that could be going on. They're like, yeah. And I said, okay. So what else did you notice? They're like, well, I started thinking about my mom a little bit more. And I started to think, like, could I be an alcoholic too? Is this something that I'm not confronting? I mean, I have my job. I have my dog. I hang out with friends. I isolate sometimes, but then I reconnect. I'm never late to my job. Never late to see you. Go to my doctors. I enjoy myself. And I said, got it. Okay. So imagine now if I never even brought up their environment at all. At all. And I said, rewind everything. Let's go to the very, very beginning. First time meeting them. They say this, that, and the other about their day. And I say, okay, let's just jump right into resources. Let's just dive right in. Teach them like a coping skill that helps distract them whenever they do think about their mom. Okay, that makes sense, I think. And then they drink and they think about their mom, and then they cope by distracting themselves. And then I see them that following Monday and I say, how was your average week? What went well? They're like, well, I drank and I thought about my mom and I coped through it and I felt better. Got it. Cool. Now what? And you see, my goal isn't to compare about which one's better or worse, but in my years of working with a lot of people, the distraction part is distracting. I get it. It's quicker, it's easier, and it does require a lot less processing versus talking about just the environment that you're in, just starting there. Because this person clearly was bothered by bottles in their home because it reminded them of something very, very deep and painful from their past. And that they even compared themselves to their parent. And imagine we go through all the stages of trauma. Maybe they work it out. That would be great. But maybe starting with your environment could be even better, de-triggering it. Because when they removed the bottles, they noticed it was still on their mind. And then when they were coping with it, they just pushed it out of their mind. And maybe, just maybe, this works with some people. I've seen it. But man, there's a lot of people who are way overdue to just kind of confront these things, the things that are in their environment, whether it's a bottle of alcohol, whether it's a phone number in your phone, or someone that you're still following online that's like an old friend or an ex. Reducing access to that removes the trigger for those things to just pop up. And you might think, but wait, Jake, what if those things just pop up in other environments? Well, you can't really stop that. But the point is to start at home. The point is to start in a space where you have likely most of what you can control. Because I get it, like, you can't control a ton of things outside your space. But that doesn't mean you can't even attempt to make any adjustments within your own space. That's where there's a lot of empowerment. Because imagine if this same person were to say, I slowed down my drinking a bit, and I noticed that I'm sleeping a tad bit better. I didn't even know this was a problem. And you know what? I think about this a lot. My mom never slept. She never slept. She was always just up drinking. And then when she did sleep, she was passed out. And that made me feel so neglected. Constantly. And whenever I drink, I feel shame. And boom. We've just tapped into something very triggering, very deep, and something very important for their beautiful process that will come next. I hope that helps.